you know, we were feeling the heart rate and listening to the heart rate, and, you know, could tell that it was like 120s, 130s, and you know, fine, and on the little monitor it would say like 50 or 60, yeah, and so we weren't believing that at all. So we just went ahead and, you know, clinically looked at the baby, saw that the baby was active and all that, and then let the baby see, we did do some suctioning. We did lots of suctioning, I mean, including DeLee suctioning, which is that really thin little tube that we can put down the nose all the way down into the lungs as much as we can, and then we suction a whole bunch of clear fluid. So there was no meconium involved, thank goodness for this baby. So, and then the baby got upstairs. We brought the baby up to the nursery. She seemed like she was gonna, you know, start to transition and do okay. And so at around 8:55, I forget what time was the baby born. It was like, I don't know, this was
10 minutes
however long it took us. Yeah, however long it took us to get upstairs from. Yeah. So this is like 30 minutes. Yeah. So anyways, the O2 sat though as soon as we got up here, Angie noticed that the oxygen saturation was low. The baby looked a little pale, so they were able to check the O2 sat up here, and now it's been, you know, over 30 minutes. So that other this one. So after 10 minutes, they should be, you know, at least to that 92% like we were talking about before. So for the baby to only be 73 to 87% was too low. So they started blow-by oxygen, and they called me. And so I came up there, and respiratory therapy was notified as well. So that was right along with the protocol, right? So anyway, so we did start the oxy hood. And so then the baby seemed to be doing a little bit better. Baby improved. The SATs were 98%, looked really good, but we thought, you know the baby drank in all this fluid and breathed in whatever this, you know, amniotic fluid was. We better just check a chest x-ray and make sure it's okay. So the chest x-ray came back and was actually, it showed a lot of fluid as we sort of expected, but nothing else. There was no pneumothorax, there was no, you know, big consolidations or anything like, you know, looking like a pneumonia or anything like that. So nothing else strange and more than expected. However, it was abnormal, right? So that was one of the things on the protocol too. The chest x-ray is abnormal. So then we were watching the baby clinically. It did have some retractions on the left initially, and then it improved. So at 10 o'clock it was improved. We switched the baby over to nasal cannula, which it didn't really like. The baby was very angry about that and fought that a lot. So then we just weaned the oxygen, and we thought, well, we'll just give the baby a chance. You know, she's improved, doing better, or she. So then by 10:35, the baby was noticed though to be tachypnic. So now the protocol kind of started over. You know, at this point, the baby had improved initially, and then suddenly, you know, without the oxygen, was breathing 90 to 100 times a minute. So again, greater than 60 is tachypnea in the newborn. So the SATs were still good. Still greater than 92%. In fact, they were like 96, 98% on room air alone. But because of the work of breathing, we decided we'd go ahead and put the oxygen back on the baby and see if that didn't help with the work of breathing. So we did that. So we restarted that around 10:35, and then by 11:48, the baby was actually doing a lot better. And they tried to wean the oxygen again, but it just then the respiratory rate just went right up again. So it was pretty clear that with the oxygen, the baby did better. Without the oxygen, the baby got worse. So that was very persistent, you know, from 10 to 12, you know, that had been the good 2 hours. We gave it a chance to improve and continue to improve. Instead, the baby was sort of persistent and not really better overall. So that was when we made our decision to transfer the baby. And this baby ended up going, I think, to St. Elizabeth over in Lafayette. So we called, and they actually came, I think they came pretty quickly. They got there by
35, 40 minutes.
Yeah.
After we called them.
Yeah.
Very
within an hour or so. And then I'm pretty sure the baby did well.
Yeah, I actually got a call from the mother 3 days later. The baby had been released to home. They did a couple days of antibiotics, but decided that as that fluid dried out of the lungs, the baby continued to just improve and was able to be released to home. Come on.
So did they keep the baby on oxygen and just slowly wean her? Or?
They have incubators, so it would be similar to an oxy hood, except it's the full body thing. And yeah, she was able to be weaned. They tried putting her on nasal cannula when they got to us as well, and she was having none of it. So the
So
The
they didn't
report-
really do anything differently so much, but they
No.
just watched,
Not
just,
that we're
just a
aware
better,
of.
more controlled.
Yeah, part of it is that,
Yeah.
you know, because here, the physician, I'm not here, you know,
Mhm.
all night long and everything
Yeah,
else.
sure.
It's
So-
not safe for the baby.
So everything was done well, it's just that they have a
Absolutely.
little more
Yeah.
advanced,
But
or
when it's
more,
persistent, yep.
more,
Well, and
It's,
facility
it's
and
safer,
things.
and they can do
Yeah.
other things
Yeah.
if needed as well.
yeah, cause you still didn't know why.
And
If
we
the
don't,
baby
right, and we
wears
don't
out,
know.
Yeah,
we
yeah.
don't
Intubate
have
and
that
all that.
advanced, you know,
Oh,
capability here. So that baby needs to be, we're a level
Oh,
one
I know,
facility.
when they were out there, they crashed, so,
Yeah.
yeah.
And we don't, you know, we don't like to keep them here until that happens, so that's kind of part of the rule of 2 hours. If you know, we could have kept the baby overnight, you know, but then here you are, that's what happened in all these other small little hospitals and these studies they did, and the baby then is on oxygen for 3 days and no one really knows why.
Yeah.
That's never a good situation. And then when they transfer them after 3 days, well, now they find out that they've got some congenital problem and they, you know, should have had surgery 2 days ago,
And
or
they've
who
been
knows.
exposed to oxygen for 3 days.
And they have this, that's right, and so they might have some, you know, sequela from that, and so it's just, it's a lot safer for them in the long run, and for us too, so.
Oh, I'm a big believer in that, you know.
Yeah,
I
yes,
don't like people hanging around.
that's right.
If we have questions.
When they don't belong, they don't belong.
Small or
so-
big, yeah. Move them on down the line.
That's right. So I put a couple of chest x-rays in here. This is, that's baby girl patient over there. So you can see here, this is a normal newborn chest x-ray, and you can see the black is the lungs, so black is air. Air looks black on the x-ray. White is the, like soft tissue, bone, that sort of thing. So this is the heart. And then there's always a thymus on a newborn or a child, so you might be able to see that. Sometimes it's more prominent on that one, it's a little more prominent than others. But so then the little ribs are those little white things. But you can see the black, you can see a lot of black. There are little markings, little white tiny markings. Those are like the actual markings in the lungs, the actual, you know, alveoli and bronchioles and that sort of thing. So that's all normal. Okay, but then if you look over here, you can see all this white gunky, all that stuff, that's fluid inside of the bronchioles, inside of the little tubes and things. So that is what's not normal on this chest x-ray compared to that one. So I think can you guys tell from there that this is very black and that's not quite so black. So, and of course the heart and everything else, but, and then, so that's how it was read up there. Increased perihilar markings, possibly due to TTN, which is a transient tachypnea of the newborn. Bilateral pneumonia cannot be excluded, and that's basically how they read every chest x-ray that has fluid when the baby's first born. And the reason for that is because we couldn't say that it's transient tachypnea in the newborn until you know the transient part. So if we do a chest x-ray 2 days later and all the fluid is gone and all the markings are gone and it's normal, it was obviously transient tachypnea of the newborn, right? It's transient, now it's gone. But if it comes back and it's still there, well, it must be pneumonia, it didn't go away. So that's, unfortunately, in newborns, sometimes that's the only way you can tell. And we're not gonna wait for them here to find out 3 days later if they had pneumonia or not, so. But obviously she did not, so I think they probably called it transient tachypnea of the newborn, which made sense with all the fluid she had going, so. Now this is, we had another baby, back in January, a baby boy, and he ended up having bilateral pneumothoraces. And I don't know if you can tell on this one all that well, but now he had a lot of fluid too, so you can see that the lung spaces are not that black like they should be, so there's a lot of fluid there, but there's this outline of more black air right here, do you see it? It's pretty subtle. You should really be able to see an outline of the lung. There should be nothing between the lung and like the inside of the rib cage, it should be all stuck together, so for there to be an outline of like more blackish stuff, that's extra air outside of the lung that shouldn't be there. But since this was extremely subtle on our patient, I thought I would put an x-ray up that, it's a little more obvious. I thought maybe we'd be able to see it a little bit better. So that's it. Can you see the air around that left lung? Okay, so I thought that was a little easier to tell, but, you know, the babies we have here, they don't always show up as the easiest thing, so. But anyways, that other one was read as bilateral pneumothorax, and that one's a lot bigger. And that baby, we transferred him, he was having a little bit of respiratory distress, we transferred him and he did fine, and he never had to have a chest tube or anything. Sometimes we have babies that we keep here if they have just like a one-sided tiny little pneumothorax, but we thought he was kind of high risk just because he had both sides, and so he went, to, I think to St. Vincent 86th Street or something, and he did fine. So, all right. So, Angie brought in some cool equipment.
So, yeah, this is based